We looked at some of the work around the crest of the ilium in the thigh DVD. I'll review that briefly because obviously that particular area doesn't belong directly to the thigh, but I used it in that video in conjunction with the crest and then the hip and then down through the lateral aspect of the leg. This time we're doing it as preparation for working up through the ribs this direction, and we can certainly see the way in which the obliques and transversus and even latissimus dorsi all have some kind of attachment around the crest, so it happens to be one of these sort of tremendously useful areas to work with for all sorts of reasons. So it was a soft fist up against the crest, and this again is really a nice sort of bread and butter stroke. It feels good, tends to be very calming and relaxing for all kinds of people in all kinds of situations. So kind of a nice opening move. Yep. So the contact is just to find the bone, the crest itself, and then drag from anterior to posterior. And that can come around really as far as the PSIS, and then it'll feel a bit like you're just sort of falling off at that point. So I'll do that once, and you'll just know that you can do it more than that in your clinic. Okay, so what we didn't look at so much in that particular video was the way in which this work can become more about the waistline. So this can go into the waistline, and it can start then to affect those different layers of thoracolumbar fascia, also the quadratus lumborum, of course. And so this time, rather than just trying to keep the tissue trapped against the periosteum, I'm really trying to direct the contact somewhat sort of more specifically into the waistline. And you can see perhaps on the close-up there, I can turn my knuckles a little bit now and start to sort of trace in more around the bone. And I can even do that with a knuckle. Okay, so I'm going to step across and start working up into the ribs, starting out right around the 12th rib, 11th rib area. There's the 12th rib, and I've got that under these two fingers here. So I'm landing and sinking, and I'm once again thinking about engaging with the periosteum, and once again also making sure that I'm not giving overpressure. And overpressure would simply be referring to any kind of pressure that would result in my client sort of wincing or feeling like they have to withdraw the body part that I'm trying to contact. So in a sense I'm trying to sort of sneak up on it, because I would like to bring some fairly useful pressure to bear there, and if I do that slowly, that usually goes quite easily. And so to start with, I'm just following that line of the rib around to the rib articulation at the transverse process. I can do that also as a kind of a variation on the theme, and it would be probably visually it'll be identical, but I'll talk about how it's different, and perhaps the two will show up on the camera. I'm going to tuck my finger this time just in inferior of the rib and slightly kind of work back up underneath its inferior border. And once again, just being respectful of what can be worked with here. It can feel very powerful to get these different fascia of this region opened out. It's a tender area, so we don't want to plunge in there and try to get too much to happen at one time. And then there's another variation on the theme, and the way that looks is both my hands working together and they're approximating each other or reaching towards each other through the waistline. And this one, unlike so much of the work that we do, this one just is a land, sink. I'm pointing my fingers at each other through the waistline. So I'm picking up elements of internal and external oblique, quadratus lumborum, thoracolumbar fascia, probably even some effect on the more deep fibers of the psoas. And I'm just waiting there until I feel some kind of response, and that would be something that just happened a few seconds ago, which is this sense of kind of a giving way, a kind of lowering of the control. It feels like my front fingers in particular were able to sink in a little bit further, and not trying to sort of plunge in after that, just kind of waiting and seeing, is there another layer that becomes available. I can have my client reach down through her leg while I'm hanging on here, so I could have Maren sort of slide her leg across the table, taking her hip into extension, going through the heel, so feeling like she's able to elongate. And then we could play with this in a number of ways, and we could also kind of get the other end of this to be engaged, which would be to just feel like she can lengthen through the top of her head, so her head kind of goes away, her heel and leg go the other way. And the whole thing feels like it's happening sort of right through the middle of the body. And when that happens, then the back won't do a big arching thing. It just really feels like length rather than arching the back. And really all I'm doing throughout that is hanging on. Good. And just come out of that slightly and rest. Yep. So drop the table down. I probably in my practice would work at about this height, but I want to make sure that some of these shots really come down onto the contact that I'm making along the side of the ribs. So here's a very nice view of this lateral aspect of the rib cage and how it is that we can engage the tissue up along the side there. And so many people are limited with their motion. It talked about that there's often just generally limited motion in the thorax, and the excursion of the ribs is just not great. For other people, there's a lot of emphasis to the front in the breath. Sometimes goes along with a sort of high, shallow breath, and it's all oriented to the front. One of the things we'd like to invite is more attention to the side breath, back breath, or in some ways the sort of three-dimensionality of the breathing. And so this work along the side here can be a really important part of re-establishing that motion. So this is our standard kind of protocol at this point, and by that I mean land, sink, take up a contact, and then start to move superiorly in this instance. So that's one-handed, sort of slightly modified again, just so that the visual of that can be really precise. I'll sit on the side of the table to do it again, and you can see then that it's possible to get two hands engaged. And as I mentioned, I'd more likely do this standing, but this will work just fine. And you can see then how I'm able to work two hands together to bring this land, sink, hook and drag up through the side of the lat. It's also possible in this position to work the interspace between some of the ribs, and that might be based on simple palpation. Where is there space? Where is there not space? And here we have fairly uniform space, but perhaps, yeah, so let's say this one a little bit less, and I'll just work with one finger into that interspace. So once again, we can go from working broadly to starting to make the work more specific into some of the local restrictions. Okay, very good. Now that work can also be carried on up into the axilla. So I'm going to be taking now this work inside the axilla, so that's between really then pec major and the scapula or the latissimus. So I'll show there, it's a bit hidden, so I'll bring that down a bit so you can see my fingers. That's a sort of transition thing I'm doing here. I'm still not quite into the axilla, but you can see how we can continue to access that lateral aspect of the ribs through the axilla. and so on. Something that I like to do in this position is to lift up my client's arm, which is what I'll show now, and take my hand right up into the top ribs at the very sort of apex of the axilla, and rest my finger down on the ribs, apply some contact there. There's not so much room anymore to do any sort of gliding motion because we're kind of at the end of the space, available space there. But if I lift up the arm and I just expose the area that I want you to see, so pads of my fingers on the ribs, tips of my fingers pointing up underneath the humerus. So pointing up underneath the arm, and then I'll bring the arm back down onto my hand. Like that, and then I'll use this top hand just to kind of guide the shoulder down while I take my fingers up underneath the humerus, and I'll use my fingers up there quite deliberately to sort of search effectively along that territory, and you'll find quite often a lot of fibrosity in there. So that fibrosity tension can be a part of the frozen shoulder or really stiff shoulder. Sometimes it's definitely sort of post-traumatic stuff. So whatever the origins or whatever condition it's involved with, it's really useful to make this exploration up under here. And then when I find something that's tight, then I'll just work my fingers a little bit from sort of side to side. So try to sift and pry that fibrous tissue open. Yeah, and it can feel amazingly that released, and this would definitely be one of the more tender areas that we work in the body. So yeah, we need to sort of balance. Yes, I think I can do something effective here, but I want to make sure I deliver it in such a way that I don't have the person break into a big sympathetic sweat and generally want to turn around and pop me one. Okay, so that's very nice work to do up under there. So that's that kind of round of work for the lateral aspect of the ribs. There's one other thing that I'd like to show, and the position lends itself very nicely, which is to get the teres major from this position. So if I get the arm up, I'll be able to point to the territory where I'm working very nicely. So the teres forming to some extent with the latissimus, the posterior part of the axilla, although technically it's the lat. But the teres can be found in that same region, and I do this with my elbow most of the time. So this is basically just axillary edge of scapula, elbow landing and sinking, and then some motion going from superior to inferior. So the teres works a bit with the latissimus as this internal rotator of the humerus, and particularly for us body workers and the billions of people in the world who work at computer keyboards for a large part of the day, you'll find there's can be quite a bit of hang up right along this line of the lat teres. Yep. And so it's just a kind of slow melting, kind of classic land, sink, hook and drag procedure. Okay, very good. Most of the work that I'm showing through this and all of the DVDs is largely what I would consider sort of structural work, or it's engaging with the myofascia and working to change the consistency, pliancy of the fascia, as well as working with the relationship between the fascia and the nervous system. And we know that there's a direct relationship between both the sort of sensory motor aspects of the nervous system and also the autonomic nervous system. And I talk about those relationships quite a deal in the hypothetical model chapter of my book, and I don't want to go into that in a huge amount of detail here, but I'm just saying that because the work I'm going to show next is really, in a way, switching gears somewhat across to a more functional approach. And so I'm not really going to be engaging myofascia so much as just working with exaggerating some of the functions of the body. And these can produce very rapid and profound results. And I've particularly found that these functional techniques for breathing are tremendously potent. And this is how the work done in side-lying looks. I'll take my client's arm and put my hand here. I'll lift up the arm so I can clear the space in the axilla, and I'll put my hand in there. And these fingers are just sort of resting up fairly high in the axilla, and then just rest the arm back down. And then I'm going to put my other hand, will cup across the area of the clavicle and the scapula. Some maybe a centimetre or two just medial of the AC joint. I can feel the scapula with my thumb. I can feel the clavicle with my first finger. And what I'm going to have my client do in a moment is just slightly exaggerate her inhale, but not like she's going to become a great big helium balloon that will float away, but just enough to kind of get some deliberate motion under my fingers. And then you'll see that what I'm doing is exaggerating the exhalation motion with her. So she'll breathe in, and then as she breathes out, I'm just going to take the ribs and the shoulder blade, and you can see now I'm depressing all of that as she exhales. As she breathes back in, I accommodate that motion, but I don't completely take the pressure off. And then as you let go again, I'll just ask you to see if you can let the weight of my hands sort of guide that in a little bit further. Good, like that, very nice. And a little breath, and let go again. Yeah. Okay, so that's how the first of those looks. I'll show it now out here. So it's the top hand's largely pushing inferior. This hand is pushing towards the midline and inferior. So it's this kind of action which is matching the motion of the ribs, and that would be the functional technique. I'm not trying to sort of force the ribs into any kind of new pathway. I'm not trying to manipulate them, get the ribs to sit properly at their joints, but rather I'm just trying to exaggerate the motion of the ribs as it is. So it's the same, the second contact, just moving my hand down a little bit, but I'm still above the shoulder with the other hand. And we can just go through the same motion. Marion will take a slightly fuller breath, and I'll just exaggerate the exhalation with her. And then as she breathes in, I resist, but I'll still allow the motion, and see if then you can just let the whole thing drop a little bit more. Maybe a little bit of rocking at the end, and then a little breath, and see if it'll drop even further, like the whole thing can just descend. That's it. Good. Yeah. And that's important at the end of that motion to encourage that giving up, basically. It's like dropping a little bit further. And then what happens next is there's this kind of sense of slight compression at the end, and then the feeling is that the ribs actually move more and open out more. Next, I'll bring both hands along the side here. So now they're both able to push inferior and medial, so there's the action of the ribs exaggerated in, and now I'll just help exaggerate the motion going out. Good. And a slightly fuller breath. I resist and let it drop, so you get a nice sense of falling in on yourself. Good. Very nice. And a little breath. And drop, and drop, 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 drop. Good. So that one looks like this. And then finally, there's one where I will have my hand on the crest and my other hand across the lower ribs, and then I'm just able to move the ribs and the pelvis towards each other. I'd stand usually now a little bit more in behind where I'm working, but once again I'm just wanting to open this out to your view for the camera. So as she lets her breath out, I just take the waistline and slightly hold it in on itself. Squeeze, good. Slightly fuller breath in, so there's the bigger breath coming. Good. And then letting out, so inferior and medial with the top hand, meeting it with the bottom hand, a little breath. And let that go. Very nice, good. And then just sort of guiding the body back to its sense of length. Yeah, good, good. The very interesting thing is that even after we've done very beautiful and detailed and effective myofascial work through here or any part of the rib cage, the whole sort of thoracic complex, and people will report, oh, my breathing feels freer, more spacious, lovely sense of better volume, more relaxed on the exhale. We go along and we do this functional technique, and there's still more potential there. So this is interesting that there's at least two ways to approach this sort of issue of restrictions in the breathing. One is through the structures of the breath, and the other one is through working more to release some of the sort of functional fixations, the way in which trauma, stress, the habit of breathing that we might learn sitting at a job in a desk all day, the kinds of limits to the breathing that would occur there going on year after year after year, that we can quite quickly start to influence that when we add this component of affecting the function. So these functional techniques, you can see they don't take very long, and I think as you play around with them, you'll see that you quite often produce some really very wonderful results with a great economy of effort, and we like that. Economy of effort is everything. If we're going to have a long career, we need to figure out how to do what we do with a minimum of fuss, I think. Some of the abdominal work was introduced in the pelvic DVD. I'll touch into some of that again at the start of this sequence of work, which really is for the kind of superficial front of the body. And the superficial front meaning, that which lies sort of in the abdominal wall, but nothing that really lies sort of in the viscera or past that. So more rectus, obliques, transversus, and then later we'll look at some more ways to work with the psoas than many people have explored. And once again, I think one of the benefits of this approach to working with the psoas is that it doesn't hurt. And in fact, it can feel surprisingly relaxing, and people even fall asleep when I'm doing it. So that's a bit different than some of the kind of kicking and screaming that can go on around some versions of psoas work. But at the start, we're going to just work our way up through the front of the body, touch into rectus, more focus around the costal arch. The costal arch is important because of all the various myofascial structures that converge there. We'll take that then up into the pectoralis, the investing layer of fascia between pectoralis and pec minor. The rest of that work is picked up once we get into pec minor, subscapularis. That's actually at the beginning of the upper extremity arm DVD. So we're going to pretty much finish here with the work around the coracoid process and pec major. So what I'll do here is sit down, and partly because it will enable a better view from the sort of camera angle, but also because I'm going to be working across to the midline of the body, and I find in some ways that this is the most comfortable position to do that in, that standing and sort of twisting around to the midline can start to put a bit of strain in one's back, certainly in mine at times. And so here's a way to try to minimize that. This is how it looks. I'll just take my fingers down into the rectus and thinking, I suppose, really not just about the rectus itself, but the layers of fascia associated with the rectus and the rectus sheath. And then I sink, so there's a sense then of taking the rectus back towards the spine slightly, and then lifting superiorly. So there's not so much a land, sink, hook and drag, but more like I'm taking up a micro stretch and holding it there for several cycles of my model's breathing. Similar thing, staying off the umbilicus itself, but just working on either side in this instance. And one of the ways in which you know that this work is proceeding well is that without adding any more pressure, you'll notice that your fingers sink more in. It's as if your client is somehow discovering how they can just receive the pressure of your hand, or the weight of your hand, or the warmth of your hand. And this can be tremendously relaxing. We know, of course, that many people carry a lot of their stress in their viscera, in their abdomen. The sensation of being under stress often sort of manifests as sensation through the stomach, through the viscera, apprehension, anxiety. All of these states often have a strong physical component that manifests through here. And so I know that we have a sort of general desire in certain schools of rehabilitation and so on to kind of get all this area acting in a more sort of facilitated way, more toned, but that doesn't necessarily address the way in which tension has developed in the nervous system in such a way that you get this sort of chronic state of sort of slight irritability through the viscera. And I find this slow, methodical pressure with these micro stretches in the fascia will help a great deal in reducing that accumulated stress. Now, if I want to just add a movement that will facilitate a bit more of this kind of opening, just watch what happens if just ask my model to just gently kind of let her chin back up a little bit, so she's going to just and let her eyes sort of guide that motion. And you notice right away that she starts then kind of letting the ribs, I suppose, stay behind, that the ribs suddenly feel like they're actually resting a bit more with gravity. And I feel like my fingers are being received much more in here now, and I haven't pushed any harder. Yeah, so it's just something about this looking away from the point of contact, even tilting the head back that much will engage the erectors just slightly, and as the erectors engage they inhibit the flexors, and we get this delicious sense of opening and length through the front of the body. Good. Costal arch area. So yeah, we've got internal and external obliques, the rectus abdominis, of course, coming up to around the fifth rib. Behind that, we've got the diaphragm attaching all the way along. That even the xiphoid process is a kind of a focal point for some of these attachments. I'm going to stay off the xiphoid as a specific structure, but I'm going to work in quite close to it. And so that's what I'm doing next. Working bilaterally, making a contact, deliberately wanting to get my fingers around, or on top of, I should say, the costal arch itself. And I'll pause there and just let that contact go up against the cartilage. And that's happening with my index finger, predominantly, that contact on the cartilage. And then I'll take that work and develop it superiorly. So this is a bit more of our Lansing hook and drag kind of protocol. So these are the kinds of things that I'm doing all the time in my practice. Help open out the breathing, so help bring that kind of fixing into kyphosis, so shortening down through the front, starting to help that by easing out this superficial front line. So on women, working fairly close to the midline, taking this contact up pretty much. Once we get up to the area of the breast, keeping the contact to the midline so it goes up the sternum pretty much. With men, we can keep it a bit wider. And once again, I can ask for that same sort of chin motion, just a little bit sort of going away from the contact. Yeah, and kind of leaving the ribs resting with the table. The ribs rest with gravity. Yeah. And even on the up breath, there's still some sense of support from underneath. So that's how that looks. Yeah. Just pick that up above the bra there, and so you can see that working on up. we can affect the diaphragm from this position, and I'll start really right next to the xiphoid, as always. Don't want to push directly on it. It's always been one of our warnings in body work, although I have to say I've never heard of anybody actually breaking one, but perhaps because we've all adhered to the warnings and not been pushing on it too much. The general motion here is I'm at the midline, just lateral of the xiphoid, or the right side of the xiphoid in this instance. And then I'm going to turn my fingers so that they're slightly reaching back up underneath the cartilage. So I'm moving from medial to lateral. And once again, I'm sort of standing out to the side a bit more than I would. And I'm bringing now the contact in underneath the rib cage slightly. But the general action is not so much to push up superiorly, but in some ways it's to kind of reach underneath and almost pull inferiorly, almost like I'm sort of reaching up and just sort of pulling that tissue out from under there slightly. And you'll discover as you're doing this that all of this region, it's not all created equal. And by that I mean there'll be some areas, as there is just here, where you feel that there's an increase in the tension. And there are areas where you could come back and work 3 or 4 times. So my first parts might be more exploratory, still working, still getting an effect. My second pass might take me back to, oh, well look, I definitely discovered that there's a zone there that I could revisit and probably facilitate more release. Very nice, good. Okay. The next thing I want to use the skeleton for is just to look at this diaphragm xiphoid work. And as I mentioned, my finger can be really abutting the xiphoid and sinking. To begin with, I'm going posterior, and then I'm going to be working lateral and up underneath the costal arch to some extent. And as I mentioned, I would search that whole margin until I can, so I might discover a localized restriction, and I'd come back and work through that a number of times. But we can effectively work all the way along there, and that can feel surprisingly good, and part of the effect definitely travels in towards the middle of the body. So it's not just about this sort of local detensioning, but there's some feeling of things further afield, sort of in towards the middle of the body, that are also being released as we do that. Good. Pec major, and the investing layer between pec major and pec minor is what we're looking at next. And I'll often do this from the opposite side of the body, so it's convenient for the camera work today, but also it's quite a good position just because of the angle that we can get on. And really, this is our classic myofascial technique. Landing, sinking, taking up a tension in the underlying tissue and then carrying that line of tension forward. So yes, quite often the first contact gives us a nice response that then as we follow in with the second and third contact, we find that the person's able to really receive the weight of our hand a whole lot more, so that when they go into motion with their arm, they're also able to explore the sense of kind of giving their arm to the table. So you're going to get Maren to externally rotate and abduct as she goes into motion. Yeah. Okay, with a heavy arm. Yeah. That's lovely. And so really with that, even just by reminding via saying the heavy arm, feel like the shoulder lets down onto the table. We want the shoulder to live kind of now back into the table, into the mat. Yeah. Yeah. That's great. Good. And come back. So that's my fingers are right on the coracoid process there. So that's our basic sequence to work through that area, starting with this client somewhat more passive, starting to get the tissue opened, then we get the client engaged in some motion, and that is what we saw, just that kind of nice easy reaching while I'm holding the tissue around the coracoid process. And we might continue with that for a number of times and come at it from a number of directions. So I might make another pass where I'm quite a bit higher, and I might this time sort of snug it up against the clavicle more. So even starting to affect there some of the fibers of the subclavius. So there I'll try to just give 2 fingers so you get a clear shot of that. So one of the things you want to start to develop is a sense of responding to what you feel, and as I sometimes put it, you don't want to sort of abandon the chase too early. If you notice an area is tight, the shoulders really are caught in this sort of anterior fixed position, and you're working your way through, methodically doing the techniques, and you still don't feel like you've kind of rung the bell yet. Okay, keep at it a bit. Try some different angles. Try to bring some sort of freshness to the touch, so we're not just sort of going through the same pass each time, but we're coming around from some different directions and actually varying the pressure at the same time. With men, we have a bit more territory that we can access. We can certainly work much more sort of through this midsection of the pec, and that could also feed into the coracoid process through there. Using the skeleton to highlight and clarify a few of the bony landmarks around some of these releases. The first one's the coracoid process, and as we work across along this pectoralis major area, eventually we get to the coracoid process, or we can, and that's really what we're trying to do. And we can really work directly on top of it, and that's something that's a bit counterintuitive for some people. It's almost like we'd want to steer around it, but it represents, like so many of these bony contacts that we make, an excellent area of convergence for ligaments, tendons, and fascia. So it really is literally that we land and hold that coracoid process underneath the pads of our fingers. We can still have a little bit of distal drag, or not distal so much as just sort of spreading, I should say lateral, a little bit of drag, but the whole thing's happening now in slow motion, so no rush to kind of get across to the other side of that. And then we have our client's arm in motion, and that in turn will be sort of twisting the coracoid process underneath our fingers. All right, very good. What we can look at next are some ways to do that functional technique, this time on the front of the ribs. The protocol, the sort of strategy of how we deliver the technique is the same, just some slightly different angles, and I'll talk about them as I do them. So this is how it looks. My handhold will go like this. So I'm wanting basically to, as three-dimensionally as I can, make a contact around the whole of my client's rib cage. And so I'm trying to share the pressure or the contact through as much of each hand as I can, so it's not a sharp sort of local focus, but actually a much sort of broader, generalized focus. So I get my client to breathe in slightly more fully, and then I'll just encourage the exhalation and taking it past where she would take it by herself. Good. And then have you breathe in again. So here I resist slightly, and then I take the ribs, and we'll just see if we can go a little bit further on that exhale phase. Good. And then a little breath. And then the whole thing might drop a little bit further. Good, 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 good. And there, just at the end, it certainly did happen. You'll know that this is working when on the second or the third time when you take the ribs in, it's almost like the clutch gets thrown in and things just drop suddenly. It's kind of like they're in gear. There's some sort of tension associated with that, and then suddenly the clutch goes in and the ribs just fall down further than they have been. After that, the next in-breath feels fuller and less restricted. Don't have to do it a lot of times. So I'd call that one cycle. If I didn't feel like I was getting very far, I'd do another cycle, so another round of 3. And all the time trying to draw their attention to when it is that they let go. It's like, aha, there, you feel the way that drops. Yes, let's see if it can drop a little bit further on the next release. We can also work with the shoulder area and the scapula in a similar manner. So just have you roll a little bit sort of away to the side so we can show that. There's my hand across Marin's scapula, and then drop back. So that's how I'd position it. I wouldn't get her to do that. That's just so you can see where my hand has gone. Yep, so ordinarily I'd just pick her up and put my hand there. And then the front hand is matching the same directions. You can, so this hand and that hand can then work in concert together, and that's how this looks, is a fuller breath in, breathing, filling both my hands, front and back, and then on the exhale, just taking that in, rolling the scapula around at the same time, a full breath. I resist a little bit, but not completely, and just see if the whole thing can drop a little bit more. Good. And a little breath. We're not going to go back far, and then just see if the whole thing gives way a little bit more. Good. And then just letting it drop back. And also somewhat encouraging the sense of width then, but not just in the back or the front, but some sense of width through the front and the back. So the general feeling then is that the shoulder will be lying down on the table more, but also that there's a nice sense of width through the front and the back. With these breathing techniques, I'm going to be doing them bilaterally. So I'll usually do that rib work two-handed on the side of the ribs, and this work that I just did at the shoulder, I'll do that work as on one side, and then I'll repeat it on the other side. The beauty of doing one side and then coming to the other side is that you have an opportunity then to draw some attention to the ways in which one side will quite often feel markedly different from the other. And this is reinforcing of the work that we do. It's an educative component of it, people discovering something about their body, something about the breathing and the tensions that have developed around it. And the other aspect of it, I suppose, in a way, is that it gives them some feeling that things can change, that because you've done your technique and wow, it's not just a kind of happy little experience where I feel good because I'm being touched, but actually feel some change in the function, and so things can change, things can we can educate towards some new behaviors, you might say, and this can also be a tremendously potent aspect of our interaction with people. The next thing I can use the skeleton to clarify is the handhold for the rib release. So the functional release of the ribs. I really want to draw attention to the way in which the hands really embrace the whole rib cage, and it can be either the hand like this, the lower hand like this and like that, or that way. And sometimes that's necessary to turn the hand around that way just to accommodate working around the breast. So you can see how the heel of the hand might end up in the breast there. So just turning the hand around like that. But in either instance, we want to be able to feel like we're really moving the ribs three-dimensionally rather than just pushing them posterior or inferior or medial. But the action is all three of those things: posterior, inferior, and medial. The hand underneath the scapula here, as we do that motion where we bring the scapula around to the side. Your fingers can go all the way across and hold on to this vertebral border of the scapula, and that's part of the way we're able to move it around so deliberately. I get my fingers all the way across there, and then as I'm depressing these upper ribs, and again that's inferior, posterior, and slightly medial, I'm drawing up on the scapula, and I'm able to do that because I've got my fingers all the way around onto that margin there, that bony margin there. Alright, so we've looked at, in the pelvic DVD, at ways to approach the iliacus, and it's very hard really to say that it's the iliacus somehow independent of touching the psoas. So we've in some ways already seen in that DVD some ways of working with the psoas, and once again I'd like to sort of touch into that. So if you haven't seen that DVD, or you don't have the need to sort of see that DVD, you still have all the pieces of this psoas work. And then what I'll do here that's a little different from there is that I'll add some more sort of active ways of engaging with it. But I'll start with talking through the passive way that we enter into the psoas, and also just wanting to shift the thinking from so much that we're just talking about this sort of one muscle sitting back there in the front of the spine, the psoas, going down from the lumbar vertebra into the femur, but we're really thinking about the whole sort of fascial complex and all the nervous system structures that are embedded in it that lie at the back of the viscera. And so already we're starting to move away from just thinking about one guitar string that needs strumming or stretching, and starting to think more about a sort of environment of nerves and fascia, fluid, that can be talked to, and so we're sort of shifting from a sort of monological way of working into a more sort of dialogical, and not to be confused with diabolical. It's a big ask to have somebody let us work that deep in their body, and so anytime we want to go deep and minimize or completely do away with distress, we go slowly, and this is how I do it to accomplish that goal of not causing distress. I'm working unilaterally. I'm taking my fingers, basically if I draw a line from the umbilicus to the ASIS, so a sort of imaginary line, and where that, sort of in the area where that crosses the edge of the rectus, somewhere in between there and the ASIS, I'm taking my fingers and I'm going to sink from anterior to posterior, which is what I've started doing here. Now you'll notice in the setup here is that I've got my model's legs elevated, and enough to sort of take the tension out of the hip flexors and the abdominal wall so that I can sink through here without having to push through tissue that's under stretch at all. So in general, we'd like everything to sort of just rest back nicely and comfortably towards the spine. And if they're just flat out on the table, then there's often too much extension and too much stretch on these flexors. And the other thing that's possible, of course, is that I just have my model with her feet on the table and her knees up. But if she's going to be here for a while, it's going to be hard to sustain that position. And sometimes to do the psoas, I'll be working for 6-7 minutes per side. And I won't be going through 6 or 7 minutes of work on each side here, but what I will be doing is introducing the work and describing the work in terms of that kind of tempo. Part of the reason that I won't have to spend so much time here is that Marin is a kind of well processed, I suppose you could say, or frequently has had sufficient work through these areas that this isn't the first time by any means that she's been worked on here, and so she's able to accommodate the work fairly easily right from the outset. So my fingers will find themselves sinking and settling fairly easily. But this is nice. This just helps support her, helps her back kind of rest towards the table, but we don't want to flatten her lumbar spine particularly. We're not trying to sort of take the curve out completely. We're just wanting to let the tension out of the hip flexors. And even though we've been sort of down this road before, so to speak, I'm still noticing that I find a barrier where there's resistance to any further sinking, and if I wait at that barrier without pushing against it, then she lets go and my fingers then sink to the next level. And this is really how we'd like this to proceed, that there's some sense that the client sort of regulates the tempo and not so much that the therapist gets all sort of revved up with the idea that they've got to get their hand in on the psoas as quickly as possible. And there's another release. So that, these are just those sort of fairly predictable kinds of stages where the body has sort of been processing or engaged with the contact, and then the result of that is that there's a sort of diminishment of the tension, some opening starting to occur. I'd like, if possible, to come in really a bit from the side of the psoas. and that's the lateral side. And that's because, you know, some schools of thought think that, you know, the ureters run fairly predictably down the front of the psoas, and that if we park right in on top of it, coming just straight anterior posterior motion, we might be sort of jamming the ureters, which are running from the kidney to the bladder, of course, that we might be sort of just jamming those ureters up against the psoas as we apply pressure, and perhaps contributing to slight amounts of microtrauma. So anyway, that's a school of thought, and it seems worth sort of respecting that, since we can get our fingers in on the psoas without coming directly in from the front. So now I feel like I'm right at the edge of it, the lateral edge. I can verify that, of course, just by having my model start to pick up her leg, and there's the psoas pops and come up again. So I'm just at the level of it, sort of more the anterior superficial fibers. And for a lot of people, this is the psoas work. It's not as if we're preparing them for the next thing, which is the psoas work. Letting go in this way is the psoas work, and it's a very potent, powerful work. I know a lot of people are fond of the Thomas test to ascertain if you've got a short psoas. But I'd encourage you to think about this work having value even when you have a Thomas test that's nowhere near a positive. So if you've got do a Thomas test and their leg flops open fairly easily, you might still explore doing some of this deep anterior spine work anyway. So we're pretty much down at the level of the psoas. So there's a few ways we could go with this work that would make it even a little bit more deep. One is I can just pick up this same sort of ipsilateral leg, and I can just encourage it to sort of hang nicely in its hip socket in a sense, so it just starts to get a nice sensation of its weight. I can internally rotate the leg, which will slightly put the psoas on a stretch, and do these circles with the leg. So it's just sort of passively ranging around through the hip while I hang on to the psoas just above it. And that can feel quite pleasant and not too intrusive. Now I'll take my fingers out, give my model a rest, and we'll move into something that's actually more active than that. And for this I will have you come off the box. So I'm going to go back in on that same area. Okay, so that's very nice. Now I can ask for Maren just to engage into the foot a little bit here, not so much to kind of tilt the pelvis back, but just to stabilize the pelvis a little bit through the foot. So we don't want it to put a posterior tilt in the pelvis and flatten her back out, but we would like her pelvis and her leg to feel secure there. And then I'll just have you pick this leg up and slide it out. And I'm holding my fingers now somewhat superiorly so that the psoas kind of lengthening through underneath my contact. so that now I'm sort of working up and medial slightly, coming back up. Yep, and then sliding your leg out again. And yep, so here we are in motion again. Yep, and this time you could use the arm on this side and slide your arm up that way. But at the same time you're leaving your scapula. That's good. Your scapula still sort of stays with your ribs a little bit. Does that make sense? Yeah. So scapula sort of almost drawing down your back even as your arm goes away. Beautiful. And as your leg goes away. Very good. Okay.
You make it feels like double the volume of this side now.
Yeah, great. Yeah. Yeah, so this common report of volume or space, this sort of spaciousness that comes after the kind of decompression of things that have been tight, and not even particularly tight in this instance, but still some kind of change in the tone, change in the autonomic function, and the overall effect of that is one of volume and ease, which is very, very nice. Okay, well I think that concludes this material for this DVD, and that's it. Thanks very much.